opioid epidemic has become a national crisis affecting people from all parts of society. Beginning in 2017, the CVS Health Foundation partnered with the National Association of Community Health Centers to provide one-year grants to 24 health centers across the U.S., enabling these centers to find innovative ways to care for patients and families impacted by addiction. The centers use these funds to build new or expand existing services and, in many cases, were able to leverage additional funds to do even more. The CVS Health Foundation also provided additional funding to NACHC to support these health centers with a structured learning community offering access to expert faculty, coaching, technical assistance, and peer support. Here are the stories of 3 of these health centers.
The goals that we had set initially were to reduce the amount of patients who were on opioids. The CVS grant allowed us to hire a case manager who tracked the progress and collected the data, which is vital for us to see if we're doing a good job, if we're on the right track.
Case managers can start the care plan.
I go over some screenings with the patients and let them know about our program and the services that we offer. And I let them know that I'm here to help them achieve their goals.
This patient is going to come in and see Heidi today.
We're trying to help the patients to be able to control their pain better with alternatives like acupuncture, chiropractor, and also neurofeedback.
Stephen was on opiates and medicine for psychological issues.
So you ready for another neurofeedback assessment today?
I was angry a lot of the times, I thought I needed more medicine than I did, I was always hurting, it seems.
With neurofeedback, with him actually wanting to get better and doing the breathing technique, we actually cut out opiates altogether. So on the 14th session so far, the information he's reporting back to me is that, Jack, sometimes I forget to even take any medicines for pain.
In a short time, I found something that I was always looking for, and it was just a way to deal with life on life's terms.
Patients sometimes are very complicated and they're hard to reach. Psychologically, they're stuck. Sometimes it takes a long time before they buy in. And so I want to save my providers that burnout. We try to hire locally and educate our own staff who then can go home and educate their families.
The car was totaled from the car.
You have to see the patient's other factors, their day-to-day lives, their social factors. That it's not just, okay, give a prescription and that's it, you're done.
CVS Learning Collaborative was so instrumental in showing us what things we could do, what we could bring in-house, what best practices were, how other people were doing things. And through that learning collaborative, I think we were really able to change our entire practice.
Where we are right now is the Austin neighborhood of Chicago. Patients were coming to us saying that they needed a safe place to go in the community where they could get treatment for their opioid use disorder.
We now are seeing patients that come from more rural areas, someone who may have been prescribed prescription opiates for, post-operative pain management. And then prescription opiates became more difficult to come by. Patients would then turn to heroin.
I went to detox. My mind started to clear, the fog started to vanish. Started facilitating classes about recovery. A lot of guys used to come up to me afterwards and they used to let me know I helped them out.
We really felt like we had the ability to bring the medical and physical expertise, the behavioral health, mental health expertise. What we didn't have was the peer expertise. With the help of the CVS Foundation, we were able to integrate peer recovery support specialists into our interdisciplinary team. Peer recovery support specialists are a non-revenue generating service. The CVS Health Foundation and the NACHC funding allowed us to build our capacity to find a way to make these positions more financially sustainable. And with the Learning Collaborative, we were able to learn best practices from other organizations.
The peer support specialists are able to impact the patients' lives by letting the patients know, hey, if I can do it, you can do it. That they too can be successful in recovery, whether that's harm reduction, whether that's abstinence, or whatever they want to do.
There were a number of challenges associated with integrating peer support specialists into the program. How do we incorporate individuals who have some sort of criminal background associated with their substance use? We looked at our hiring policies and incorporated positions that allowed for more flexibility.
My background is a nurse, so I usually say patients or clients. When I hear the peer support specialists talking, they're always saying my peers. This is what I'm going to bring back to my peers. So I think it's awesome that they have a safe space where they could come together to help each other.
And when I see these individuals, I see me. I have to give them the gift that I got to let them know that it gets better.
Hey, girl, how you doing, baby?
Hey, you, how you been?
I'm all right.
Patients who are hard to reach in the program, who need to follow up with health care, who need to receive their medication, are able to get a visit from a peer support specialist and see what can be provided to make sure that those barriers to care are being broken down and that they're returning to the clinic for appointments.
One of our peer recovery support specialists, Tatiana, was a patient and actually continues to be a patient with PCC. She has since moved out of a participant of the groups and is now leading groups.
We'll lead off with Michelle.
Groups give patients the chance to be among others who can empathize with them and to also get support.
I always tell the patient, if there's something going wrong and you feel you need to make a phone call, call this office. I'm gonna set up you an appointment. Ask for Daryl, ask for Tatiana, ask for anybody at PCC.
The opioid epidemic is a problem for our patients here in Brockton.
It has been the biggest health crisis that I've ever seen.
We knew that we had a lot of gaps that we kind of wanted to fill in, especially with the pediatric side of things. So when we received the funding, we were really excited.
Who had a positive craft?
The craft is a series of 9 questions that will determine if the patient wants or does not want to receive help with a substance use issue.
Basically, our craft was not being administered, getting the teens input by themselves without parents looking over their shoulders saying, what are you doing? So we had to really kind of retrain and update our workflow.
We gave a lot of our MAs some language around explaining to the parent why it was important for the child to do it, why it was important that the child did it on their own without the parent looking over their shoulder so that the child could give more honest answers.
The way that we revamped the system was to take the craft screening tool into the room where the adolescents are weighed and measured instead of given to them at the desk when they first check in. And then they're told that this is between them and their provider.
I'm gonna give you this paper. It has questions on it. It's very confidential on you. And
it's to help us help them for any services that they may need or any questions that they have either with them or their families or friends. And then it's given to the provider before they actually are in contact with the parents.
Youth prevention is critical to solving this problem.
To talk to someone about your addiction.
United Voices is a teen group that we run for teens to ask questions about relationships, sexual health, drug use, substances. We decided to collaborate with the Brockton Area Prevention Collaborative. They were able to teach our teens about all the different substances. With that information, kids came up with a couple of different projects.
Welcome to the Hidden in Plain Sight exhibit.
It's a setup of a teens room, which was already something that was created that has different cues for a parent to see that the child may be using some substances. Our kids put their own little spin on it for things that they knew that wasn't necessarily in the original Hidden in Plain Sight exhibit.
Once you twist this off,
oh my goodness,
they could hide anything in here.
This is just an exhibit to give you a chance to start a conversation with your child.
So they could just be hiding this underneath the pillow, flip it over, you just think it's the regular room. Yeah.
The kids had a panel where they talked to parents about their own experience with drug use and allowed parents to ask questions about how to talk to their teens about use. Our staff learned how to administer the curriculum about the different substances to the youth. Ultimately, it opened up a conversation for youth to feel comfortable to have conversation with their friends about their use and about substances in general.
And it was a lot of role playing.
I don't. Try it.
You should really try it.
I'd rather not. My mom wouldn't like that.
I was extremely happy to be able to be a part of the Learning Collaborative. The support from other health agencies, while we're so different and populations are different, the one thing is our work always kind of drives us to want to do better for our patients, and so I think that was at the core of everything. Like being able to pick up ideas was awesome.
The CVS grant allowed me 4 hours a week that we could plan, take time to make sure that we were getting the screenings, capturing those kids that really needed help, educating the staff, which is the ripple effect. They all saw the hidden in plain sight. Most of them are moms. It gave them a way to influence their own families, who many of them live in the community here too.
At the end of the grant year, all of these health centers had made remarkable strides in improving the lives of their patients affected by addiction.
So there's been a whole transformation in how we practice, not only with patients who are addicted and with mental health patients, but with all of our patients now. I think it's transformed our whole practice.
We have a 50% continuous engagement at 1 year. That is unheard of. And I don't think it's anything beyond the fact that we provide hope. We don't ask people to leave the program. We don't chastise or penalize. We support, we offer encouragement, and we say, just come back.
This grant allowed us to designate some staffing time to an issue that's definitely rising and to an area that we weren't able to address prior to that. I'm so grateful that it allowed us the time and the space to be able to chip away at this opioid epidemic.